Hey guys, welcome back to the channel. Today is going to be the first part in a series about carpal tunnel syndrome. So today's video is really just going to go over what carpal tunnel syndrome is and a little bit of the basics, because it's one of the most common hand injuries that I think we hear about in our day-to-day lives. Everybody knows somebody who's had carpal tunnel. It's talked about more in the media, TV shows, movies, but nobody really seems to understand what it actually is. I have a lot of people come up to me and say, oh, my hand is hurting here, or my wrist, or my arm, or my elbow, and they think it's carpal tunnel. So today we're just going to talk a little bit about what carpal tunnel actually is and how to identify it, and to figure out if you may be having some symptoms of carpal tunnel syndrome. So it's going to be fun. So what is carpal tunnel syndrome? How does it work? Carpal tunnel syndrome is a nerve compression syndrome, which means that one of the nerves in our body is being compressed or squished in one of the tunnels that it travels through. In this case, with carpal tunnel, it means that our median nerve is being compressed in the wrist, this part of the hand, as it's carrying messages or signals from the brain and the spinal cord down through the arm to the fingertips, and vice versa. So it's also receiving external stimuli, any kind of sensation, whether it's temperature, touch, pain, anything like that, coming from the fingers, the hand, the arm, traveling up to the brain and the spinal cord so that we can react. If you have carpal tunnel syndrome, most likely you're going to start noticing numbness or tingling, just that kind of prickly feeling in these three fingers. So it's going to be your thumb, your index, and your middle finger. Sometimes people will feel it a little bit in the ring finger. We all have slightly different anatomical distribution of the nerve. So some people have half their ring finger innervated by the median nerve as well. But typically it's going to be these three fingers that you're going to feel numbness and tingling in. I like to think about it like this analogy. Let's pretend for a moment that the median nerve is a power charging cable that we use to plug in our laptop. We will simulate the compression of the nerve in the wrist by using a pair of pliers to pinch that cable really tightly and leave it there for a long while, sometimes a month, sometimes 6 months. Sometimes people have had this compression in their nerve for years, okay? So when you think about how dented that cable is going to be, right, it makes sense that the power isn't going to be getting all the way through into our computer or into our hand. Now, when we start getting treatment for our carpal tunnel syndrome and it starts to release those pliers slowly over time, okay, that nerve or that computer cable is still going to be really dented in that place where it was pinched for so long, right? The nerve cells have been damaged, or the cord has been damaged. It's going to take time for them to heal. So even after people are treated conservatively, or even sometimes after surgery, people will typically still feel numb, tingly, weak for probably a few months. It's going to take time for those nerve cells to decompress. Okay, just a helpful little analogy. Sometimes I think it's easier to think of things in that sort of way rather than try to picture it in the body. Okay guys, that's all for today's video. I hope you learned a little bit about basics about what carpal tunnel syndrome is. We're certainly going to talk a lot more about it in this little series that I'm doing. We'll talk more about the anatomy, the implications of it, kind of different treatment ideas or exercises, things you can start to do to make your carpal tunnel syndrome a little bit better. Thank you so much for watching this video. I hope you enjoyed it. Please like or subscribe if you're interested in more hand therapy content and topics, and we'll see you next time.